Welcome to our channel UK Visa and Immigration Updates. On Tuesday, the 1st of July, changes to immigration rules were laid out before Parliament, which will come into force from the 22nd of July 2025. This will include skills and salary thresholds increases, the end of overseas recruitment for care workers, and more than 100 occupations no longer being able to access the immigration system. Here's a breakdown of the key changes. Skills threshold. The skills threshold will increase from RQF3 to RQF6 and will result in the removal of 112 eligible occupations across all sectors. A transition period applies, where skilled workers can continue to be sponsored in RQF3 to 5 level occupations if they are already in the route, have a visa, or have a certificate of sponsorship issued before the 22nd of July 2025, even where an occupation is not on the immigration salary list or the interim temporary shortage list. Salary threshold. Most applicants on a health and care visa, who are new to the route, or extending a switching and are paid according to national pay scales, will still need to be paid at their relevant pay scale, or £25,000, whichever is higher. The changes announced on the 1st of July 2025 do not change this requirement from current immigration rules. From the 22nd of July 2025, going rates and salary thresholds will increase and will apply to new visa applications, as well as renewals. There is no transition period for this measure. For skilled worker applicants, after April 2024, the general salary threshold will increase from £38,700 to £41,700. Salary thresholds will also increase for other routes, such as PhD holders. If a role is on the immigration salary list, or the person is a new entrant, the salary threshold will increase from £30,960 to £33,400. For skilled worker applicants that were en route before April 2024, the general salary threshold will increase from £29,000 to £31,300. PhD holders will also see their salary threshold increase. Interim temporary shortage list and immigration salary list. The immigration salary list will be phased out, but remain in place until December 2026. The following health and care visa roles now appear on the expanded immigration salary list, with a salary threshold of £25,000, or their occupation going rate, whichever is higher. Residential, day and domiciliary care managers and proprietors. Laboratory technicians. Pharmaceutical technicians. Nursing auxiliaries and assistants. Care workers and senior care workers both appear on the immigration salary list. However, new visa applications are closed and in-country switching applications will only remain open until the 22nd of July 2028, with this kept under review. In the interim, a time-limited temporary shortage list will sit alongside an immigration salary list. This will enable international recruitment only where occupations are key to industrial strategy or building crucial infrastructure. Laboratory technicians are the only health and care visa occupation that appear on the temporary shortage list, regardless of years of experience. 5 roles currently eligible under the health and care visa have been removed due to not meeting the skills threshold and are not on either the immigration salary list or temporary shortage list. Therefore, they will no longer be eligible for sponsorship, and domestic workforce strategies will need to be in place. They are healthcare practice managers, medical and dental technicians, health associate professions, not elsewhere classified, ambulance staff, excluding paramedics, dental nurses. The Migration Advisory Committee has been commissioned to conduct a review of the temporary shortage list, including occupations, salaries and benefits. Occupations on the temporary shortage list will not be permitted salary and visa fee discounts. The occupations included on the TSL are time-limited until the end of 2026 and will only remain beyond that date if the Independent Migration Advisory Committee recommend it. Workers sponsored in occupations on either the temporary shortage list or the immigration salary list at RQF levels 3 to 5 will not be able to bring dependents. This does not apply to occupations at RQF 6 or above, or workers sponsored in occupations at RQF levels 3 to 5 who are already in the skilled worker route and able to bring dependents before these changes come into effect. Adult social care. Care workers, SOC 6135, and senior care workers, SOC 6136, will no longer be able to make new applications for visas. A transition period will be in place until the 22nd of July 2028, which will be kept under review, and will allow individuals to extend or switch from other visas routes, after which these roles will be removed from the immigration salary list and temporary shortage list. Workers must have been legally employed by their sponsor for at least 3 months prior to their application to qualify. The requirement for sponsors to first try to recruit from the pool of skilled workers seeking new sponsorship will be removed before sponsoring new recruits for visas, due to the closure of these visa applications. Providers are still encouraged to engage with regional partnerships to employ displaced workers. To prevent the occupation SOC 6131, nursing auxiliaries and assistants, being misused, a clarification is being added to confirm this occupation code only applies to roles in environments where registered nurse roles also exist. Further changes to be implemented by the end of this year also include increasing of the immigration skills charge by 32%, uplifting language requirements across the immigration system, unveiling a new family policy framework to Parliament. Please subscribe to our channel and hit the bell button to get timely notification of upcoming videos. Thanks for watching. Goodbye.